Good morning. I am Dr. A.Ahamed Basha, Professor of Physiology, Chettinad Hospital and Research Institute. Today, I will be speaking about how to record a standard ECG, that is, recording of a standard ECG. ECG, an important diagnostic tool in cardiac care. Modern ECG machines are portable and they are very much user friendly. But even though if it is an user friendly device, errors in recording an ECG may end up with wrong diagnosis, and also it will affect the management of cardiac diseases. So, the greatest challenge in recording of an ECG is a consistent recording technique must be adopted. The personnel, whoever recording ECG needs to be qualified, trained, and he or she has to be an expertise in the recording technique. So, in this module we are going to see a clear step by step approach in recording of an ECG. In ECG OSCE guide, we are going to see a step by step approach under following heading. Number 1 is what are the prerequisites. In prerequisites, ECG recording personnel, that is, we are going to see who can record the ECG and how to identify the patient and how to maintain the privacy of the patient. Next is patient preparation. Under patient preparation, we are going to learn about how to get an informed consent, how to place the patient over the couch. Next, how to prepare the skin for the placement of electrode we are going to learn. Under electrode placement, we are going to learn about how to place the limb leads and where to place the limb leads as well as chest leads, that is the techniques for locating the chest leads. Next, how to obtain a good quality ECG recording. In that we are going to see what is the paper speed to be kept while recording, how to calibrate the ECG machine and how to avoid the artifact. After recording ECG, what are the steps to be done, we are going to see one by one. First, we are going to see ECG recording personnel. ECG recording has to be done only in the healthcare setup. The ECG recording personnel must be a qualified, trained and expertise in the recording techniques. The personnel may be a doctor, a nurse or an ECG technician or a researcher, especially those who are involving in the ECG related research activities, and allied health professional. So, these healthcare providers can record ECG with the proper training and expertise in the recording techniques. Next, patient identity. The healthcare provider must confirm the patient identity before recording the ECG. How to confirm the patient identity? Patient identity can be confirmed by checking OPD or IPD number. Next, the healthcare provider has to check the name with initial, because sometimes two persons may be with the same name, hence always check the name with initial. Next, healthcare provider has to check for age of the patient, sex of the patient, then wristband, especially for the pediatric population, wristband has to be checked for the confirmation of the patient identity. Further, the healthcare provider can check for case record to confirm the patient identity. But in case if the patient is not able to speak or not in a good orientation, the healthcare provider can ask the caretaker of the patient to confirm the patient identity. Patient privacy. The healthcare provider must maintain the health information privacy, and also he or she has to adopt the human values, especially at the time of recording an ECG. The ECG recording to be done in a closed room. If the patient is a female patient, one of the female ward staff member or a patient attender must be present throughout the ECG recording procedure. Next is informed consent. The healthcare provider must inform the patient about the procedure of ECG recording in a friendly language. That is, the healthcare provider has to say to the patient that ECG is a record of an electrical activity, and the procedure involves placing of an electrode over the body sites, and that electrode is connected to the ECG machine. The ECG machine records the ECG. So, entire procedure has to be explained to the patient and gain a consent from the patient to proceed the ECG recording. Next, we are going to see patient position. Under patient position, exposure of lower limb and wrist is necessary to connect limb leads. Adequately expose the patient chest for placement of precordial electrodes. Offer a blanket to the patient so that patient has to cover the entire precordial area. Only at the time of recording, for placement of electrode, that particular area alone has to be exposed. The patient has to lie down on a clinical examination couch with the head tilted at an angle of 45 degree. Ask the patient whether the patient is feeling any discomfort or any breathlessness, pain, etc. Only if the patient is comfortable, then you proceed for ECG recording. Next, we are going to see skin preparation. Skin preparation is done in order to avoid an artifact in ECG. Some people may have an additional hair in their body. That additional hair may interfere ECG recording. In order to avoid that, wherever you are going to place the electrode, that particular area alone has to be cleaned, and that particular area hair, that is the hair where it is present in that particular area, has to be shaved. In case if the skin is oily, clean the site with alcohol and wait till the alcohol dries. If the skin is visibly soiled, it should be cleaned with soap and water. Apply required amount of gel to minimize the skin to electrode impedance. If the healthcare provider is using a ready-made electrode sticky pad, then the center of the sticky pad should not be pressed because it may lead to leakage of electrode jelly. Next, we are going to see limb leads. Limb leads are indicated as RA, right arm, LA, left arm, LL, left leg, RL for right leg. RA electrode has to be placed near or above the wrist joint or in the right deltoid muscle. LA, that is left arm electrode, has to be placed near or above the left wrist joint or in the left deltoid. Left leg LL electrode has to be placed above the left ankle or in the upper leg. Right leg above the right ankle or above the right leg. So, these are the placements of limb leads in the right arm, left arm, right leg and the left leg. Generally avoid placing electrodes over the bony prominences, thick muscles or skin folds which could interfere the wave transmission. Next, chest electrodes. Chest electrodes are the electrodes placed over the precordial surface. Chest electrodes are indicated as V1 to V6. All these 6 electrodes are placed over the precordial surface at a specific location. V1, the first chest electrode, is located or is placed right fourth intercostal space nearer to the sternum. V2 is placed at left fourth intercostal space nearer to the sternum. Next, we are going for V4. V4 is placed left fifth intercostal space at the level of mid clavicular line. Mid clavicular line is an imaginary line that falls from the center of the clavicular bone downwards in the thorax. After placing V4, V3 has to be placed in between V2 and V4. Next lead is V5. It has to be placed at the level of V4, that is left fifth intercostal space, but at the level of anterior axillary line, that is nearer to the anterior axillary line. Next, V6. V6 is placed in the same plane as V4 and V5, but at the level of mid axillary line. Once all lead electrodes have been applied, attach the associated limb and chest leads with a cable for each lead lying inferior to the electrode. This has to be done in order to reduce the tension of the wire. We saw about 12 leads are there, limb leads, chest leads, but the color coding in the leads and the label in the leads are not same universally. There are two different classification of leads are there for its color coding as well as for its labeling. Number one is American Heart Association labeling method. Here they are labeled chest leads as V1 to V6, limb lead as LA, RA, LL and RL. On the color coding they have indicated as for chest leads either it is brown or red, yellow, green, blue, orange or purple accordingly. Similarly, for limb leads they have given a color coding black, white, red, green. But there is another classification which is called as International Electrotechnical Commission classification. Based on IEC label, the chest electrodes are labeled as C1 to C6 and limb leads electrodes are labeled as L, R, F, N. Similarly, the color coding are white for the chest leads or red, yellow, green, brown, black, purple accordingly. Here for limb leads the color coding for L it is yellow, for R it is red, green, it is for F it is green, for N it is black. So we can see the colors here. For right arm it is white, for left arm it is black, for left leg it is red, for right leg it is green. So this picture follows American Heart Association labeling method of ECG. Similarly, if we are using as per IEC label, then color code varies accordingly. Till now we saw about various ECG leads and its location, its color coding, its label. Now we are going to see how to place the chest electrode exactly in a correct manner. For that there is a technique to identify the various position. For that, first the healthcare provider must place the finger over the patient's tracheal rings, that is this area the healthcare provider has to place the place the finger over the tracheal ring. From there slowly the healthcare provider has to come down. The healthcare provider can feel a notch, that is the yellow color area, which is called as suprasternal notch. After locating suprasternal notch, that is from suprasternal notch, the healthcare provider has to come downward, which is the sternal bone. It contains three parts: manubrium sterni, body of the sternum and xiphoid process. When the healthcare provider moves the finger downward, he will feel a little elevation or a lump, which is called as angle of Lewis. Angle of Lewis. This angle of Lewis plays an important landmark in locating the ECG chest leads. Angle of Lewis. The angle of Lewis corresponds to the second rib on both the side. Just below the second rib, the space is second intercostal space. Next, third rib, third intercostal space, fourth rib, fourth intercostal space, fifth rib and fifth intercostal space. So in this manner, first the healthcare provider must locate the fourth intercostal space. So once if the fourth intercostal space is located, right side nearer to the sternum, V1 electrode has to be placed. Exact opposite to the fourth intercostal space, V2 has to be placed. V4 has to be placed in the fifth intercostal space. In between V2 and V4, V3 has to be placed. V5 same plane as V4 at the level of anterior axillary line. V6 in the same plane of V4 and V5 at the level of mid axillary line. So the placement of electrode over the precordial surface is an easy procedure. Only thing is the location of an angle of Lewis is a must. That technique has to be learnt. After connecting all the leads, we have to adjust the paper speed. The normal standard paper speed of an ECG machine is 25 mm per second. The ECG paper runs between voltage versus time. In the x-axis it is a time duration, in the y-axis amplitude voltage. If you see the ECG paper, I can see small squares with the thin lines and a large square with the thick lines. So one small square in a horizontal plane is equal to 1 mm. The duration is 0.04 second. So one small square is 0.04 second, then for 5 small square is 5 into 0.04 is 0.2 second, that is one large square is 0.2 second. 5 large square makes 1 second, that is 5 into 0.2 second equal to 1 second. So one small square is 0.04 second, I am sorry, one small square is 0.04 second, one large square is 0.2 second and 5 large square is 1 second. This is for the time duration. Next, if we move on to the voltage, 1 millivolt is equal to 10 small square. So, 10 small square is 1 millivolt. So, before recording an ECG, the paper speed has to set 25 mm per second. Still, there are other speeds available in the ECG machine like 50 mm per second, which is used particularly at the time of atrial flutter, or with a higher heart rate the speed has to be adjusted to 50 mm per second. Next, we move on to the calibration. After setting the paper speed, we have to calibrate the ECG machine by pressing a calibration button on the ECG machine. If you press the calibration button, one single press, that is 1 millivolt calibration signal is expected to produce a rectangle of 10 mm height and 5 mm width on both the sides. So, whenever recording an ECG, after checking the paper speed, the ECG machine has to be calibrated and it has to be checked for 1 millivolt calibration signal, whether it is producing 10 mm height and 5 mm width like this. A rectangle with 10 mm height and the 5 mm width. This is the standard method to be followed before recording a ECG, because if calibration is not done, it may lead to wrong diagnosis. An additional facility is available in the ECG machine is filter. Depending upon the need, the filter can be switched on or it can be switched off. In case if there is an evidence of somatic muscle interference, repeat recording with the filter on and a recording made at 0.67 to 40 Hz. Always both the sides calibration is advisable, that is from the left hand end as well as on the right hand end calibration has to be done. Next, we move on to the artifact. Artifacts are the electrographic alteration not related to the cardiac electrical activity. This artifact occur in the ECG wave which may give a wrong graphical representation. So, it has to be avoided while recording the ECG. The cause for the occurrence of artifact might be due to poor grounding of the device or interference by the cell phone, or due to electric beds, or even due to fluorescent lamps which is present in the ECG room while recording. So, fluorescent lamp has to be switched off in case if we get an artifact in the ECG. After recording ECG, the healthcare provider must switch off the ECG machine and detach the ECG cable, inform the patient that ECG procedure is over, and educate that removal of ECG electrode may cause mild discomfort. So, after informing, remove the electrodes. Thank the patient for the ECG recording, then label the ECG paper, that is the identification, name of the patient, date of birth, date of recording, sex, hospital number, indication of an ECG, all has to be mentioned in the ECG paper. After the entire procedure, wash the hand, that is healthcare provider has to wash their hands with an antiseptic lotion. Next, we can see what are the other ECG devices where ECG can be recorded, that is wearable ECG recording devices. Among the available ECG recording devices, number 1 is Holter monitor. Holter monitor is a portable electrocardiogram which records the electrical activity of the heart for a period of longer duration, that is from a day to even many days. This Holter monitor is useful in order to identify certain electrical or ECG changes that cannot be seen in the exercise testing, or else to identify irregular heartbeat and palpitation, this Holter monitor plays an important role. The other wearable device is smartwatch, which is available in the market, where it is a ECG recording enabled smartwatch. It combines everything from a sleep tracking features to ECG monitor. So, this presentation is to be used as an adjunct to other learning methodologies and not a substitute for appropriate clinical training and qualification. I would like to thank my institute, Chettinad Hospital and Research Institute, and NPTEL-NOC for giving me an opportunity for this presentation, and the sources of references that I have used are Guyton and Genong.